Hi, and welcome to Pizotifen Maleate. My student ID is 3274494, and I hope you enjoy. Pizotifen Maleate belongs to serotonin antagonist class of drugs. It is used to prevent migraines and cluster headaches. It works by blocking serotonin and histamine receptors, which are thought to play a role in causing migraine headaches. By doing so, pizotifen actually helps to reduce the frequency of these headaches, and it is not typically used for treating acute migraine. In fact, it prevents the migraine or the future migraines from occurring again. And moving on, let's talk about absorption. The absorption half-life of pizotifen following oral administration is 0.5 to 0.8 hours in an adult male, with nearly complete absorption rate of 80%. Maximum blood levels are reached 5 hours post administration, and the absolute bioavailability is 78%. And if we talk about the volume of distribution, the volume of distribution in an adult male is 833 liter for pizotifen and 70 liters for the N-glucuronide conjugate. Plasma protein binding of pizotifen is greater than 90%. And the metabolism, the pizotifen is extensively metabolized in the liver, where it primarily undergoes N-glucuronidation to form the main metabolite. N-glucuronide conjugate accounts for at least 50% of the plasma and 60 to 70% of the urinary excreted radioactivity. And lastly, the elimination. About one third of total orally administered dose is excreted into the feces. Less than 1% of the total dose is excreted in the urine as unchanged parent drug, and up to 55% of the dose is excreted as its metabolites. And moving on, if we talk about pharmacodynamics, so it actually blocks the serotonin receptors in the brain, which ultimately leads to the prevention of vasodilation, which is actually the widening of blood vessels of brain. And when it prevents, it just stops migraine from occurring. But moving on, we can also see the side effects of it, which are actually the drowsiness, which occurs due to the blocking of histamine receptors, as well as increased appetite, which also result of change in serotonin levels. And the dry mouth and blurred vision is also caused by the pizotifen, which is due to the weak antiogenic effects. And if we look at the interdisciplinary teams of pizotifen, so pizotifen actually belongs to Schedule 4. So it's a Schedule 4 medicine, which means that it is a prescription only medicine, in which pharmacists can only give you this medicine upon giving them the valid prescription from a doctor. And if we talk about the prescribers who can actually prescribe these medicines, they may include the neurologist, primary care physicians, psychologists, and nurse practitioner as well. And the common adverse effects of pizotifen are also the dry mouth, which actually caused because the entheogenic activity pizotifen can lead to reduced saliva production that ultimately results in the dry mouth. And it also causes the weight gain. And it's very interesting that how it is caused. It actually caused because of the increased appetite, and we start eating a lot, it ultimately increased in the production of weight gain. And let's talk about the counseling points of the pizotifen. As pizotifen may make you feel drowsy, especially when you first start to take it, and may increase the effects of alcohol. So after taking it, do not drive or operate any machinery if you are affected by the drowsiness. And if you want to leave this medicine, do not leave it immediately. Reduce dose gradually when stopping the treatment, and abrupt cessation may lead to acute withdrawal symptoms, for example, anxiety, tremor, dizziness, insomnia, and weight loss. that can be severe as well. And lastly, there are knowledge tests for the pilotofen.